So is BMI or body mass index diagnostic for obesity in children? The answer is absolutely not. It is true that it is still used in the medical community, and even the American Academy of Pediatrics still does recommend screening children with BMI in the United States for obesity. But we all know that it has significant problems and limitations with actually diagnosing obesity in the United States in children. There's a few reasons for this. It is a good indicator in general when you look at taking height for weight, and then there's a percentile, and you can see what percentile the child's BMI is on compared to other children their own age. But here's the problem. It doesn't take into account their muscle mass. It doesn't take into account their bone mass. It doesn't take into account their overall body structure. And it can overly diagnose obesity and underdiagnose low weight or eating disorders. So while your doctor is likely still screening with BMI, because it's the only real tool we have for screening, meaning it's quick, it's easy, it's evidence-based, and it can be done in everyone, it should never be used for diagnosis of obesity. And that is the problem that we have with it as medical professionals, that dietitians have with it, that patients have with it, that parents have with it. We need a better tool that we can use for every patient that better assesses their risk of obesity, and that leading to a risk of cardiovascular disease. So what's more important is to get into your primary care office with your child and talk about their eating habits, talk about their overall level of activity. Are they emotionally eating? Are they intuitive eating? Are they eating well-rounded? Are they getting enough fiber, for goodness sake? Because all of our kids are lacking in fiber. Are they moving their body for at least 30 minutes a day? What is their attitude towards food? Do they have a healthy attitude towards it? How can we best support the family, regardless of the child's BMI, to make sure that they have a lifelong better relationship with food than people in my generation did? Let me know your thoughts on BMI.